guys.
Hello,
Hi.
ladies and
Hello.
gentlemen. Welcome to another episode.
Welcome.
Yes.
We're back again.
We're back
Yes.
again, and today we had a hot and juicy.
Yes, we did. We did.
Right.
We did.
So we talked about a lot of things. Well, two major things really. So
Yeah.
one was
Nervousness
Mhm.
around accomplished
people.
Yeah.
Yeah.
How to tackle
how to
that
manage
and
it,
overcome and manage it. Hopefully.
That's
So
when you work alongside these people.
Yeah, when you work alongside
How
people
to
that you
manage
perceive
them.
are very accomplished.
Mhm.
Yeah. So yes,
And then
that
we
is
also
one of it.
discussed
The health inequalities.
Health inequalities, racial issues that BAMEs suffer.
yeah.
Yes.
Yeah.
Yes. All the racial. And then again, let's just say, please advocate for yourself. It's like we're jingling it right now. Please read, like Miss J says, read whatever leaflet you have been given at the hospital and advocate for yourself.
Anyway,
Ask
before you say
questions.
whatever we have talked about, let you go and listen. So go and listen to the podcast,
listen.
and I know you enjoyed this episode. Leave your comments as
Hopefully.
usual,
Yeah.
and
Share your stories. We want us to
Yeah.
share your stories as well.
Listen,
Yeah.
and share
Yeah.
stories.
Yeah.
Yes.
all right then. Enjoy the episode.
First time I was introduced to Ghanaian cinema, like, oh my god, you are this man.
So yeah, now I mean, like almost since what?
But you're going to offer me the job, but what's holding
When?
you? Exactly.
They just want the best of the best.
My Oga at the top said no.
No, you're made for medicine.
The woman is the crown. Have you ever seen where a crown is chasing after the king? Come and wear me. No, I don't understand people that take loan. That's the one I don't
People take
understand.
loan for weddings.
You're counting what is it?
They are not sprayed though. Hey,
The floor is still
the
empty.
floor is still empty.
Who is doing more? At that particular instant, the man should get it back. Get out.
Hi guys, welcome to another episode.
Hello.
Hi.
We're back again. Loud Mama Podcasts with your hosts, Miss J, Dumi, and M. Welcome. Hi guys. How are you
Hello.
doing?
Welcome.
Thank you. How are you ladies?
I've been doing okay. In fact, I'm now the poster girl for extra juicy above and beyond. And I know I said it here that was something I was not
I know you agreed we would not be going above and beyond this year.
That was one of the places I said I wasn't going to this year.
So you've already gone there. We are in January.
We are in January. Barely even over.
Yeah.
And I'm the poster girl for extra juicy above and beyond.
Wow.
Like above and beyond is looking at me and going,
What happened? What happened to aura for aura?
I'm way
But
too
I
nice.
just hope you're not stretching yourself. Like you're
I
okay
am
with doing
stretching
it.
myself. Okay, I am okay doing it, but I'm stretching myself and I'm frustrated. I don't work on Fridays. But I had to drive all the way from where I am to where I needed to go, which is an hour 12 minutes, just to write a script. And because there was none of my colleagues who work within, like in that area, was going to be around.
Yeah.
So I had to make that drive because I knew that this patient was going to go without if I didn't write it. And then calling the patient, come and get your script. Like, well, nobody told me on time. I won't be available. Is there any way to get to the pharmacy? The pharmacy had the people who take the script that post it had gone, and it would take like 2 days, in fact, to even get to the pharmacy. That's how I carried myself to go and drop the script at the patient's pharmacy.
Wow. You're really an NHS poster child of going
So
above and
if
beyond.
you check extra juicy, not even just normal above and beyond, extra juicy.
They will love you. They will have to make you give a
You see
leadership
my-
position. when you're doing your reflection for your appraisal, you should put it.
No,
it's
I
part
don't
of your.
I don't think it's not.
No, seriously, I'm serious. That's kind of thing they love to read. How you
Yeah.
save the day.
Are you sure?
You
It's
save the
like
day.
maybe you
Yeah.
don't know how to set boundaries. You don't know how to manage your time and
No,
set boundaries.
that's not really it. That's about
That's
mean-
it. Because patients say, I can't. Why can't you come? It's your medication.
Yeah, well, nobody
Well.
told me on time, so I'm not around. And I was just feeling bad because first of all, medication was running low, and you've been told if you have less than 2 weeks, let us know. But honestly, I was just feeling bad. Like, do you know what? Since I'm already here, I've already
Just do it.
just
You've
do
already
it.
done the
I've
hard
already
job
done, yeah.
of
I've already done-
coming, so you can
exactly.
probably just finish
Drop it
your
off, exactly.
your goodness.
And then I went to the pharmacy. The pharmacy was on break,
Yeah.
so I had to like wally dolly around until
Gosh. Gosh. No, I don't envy you at this point.
Clock it.
no, this is not what
She's
to
really
clock.
she's
We're
really
clocking. We're clocking.
And I'm just looking at myself. Should I said I'm not going above my bill?
well, that's we put a bit of caveat. This is your job. That's different.
No.
Yeah.
No, but there are limits. You can't.
And I
You know,
don't
it just
work
reminds me
today.
of I think it was a surgery that came out in the news. They were praising them. Is it CQC or whatever? They were praising them because I think a patient rang in to say that their plumbing or something was not working. And then they sent someone, whether it's a GP or one of them, went to fix it
To
for the
fix the
patient.
plumbing. Okay, no,
Yes,
that's
something
extra,
like that.
extra
And then
spicy.
ended up calling. I'm like, so it
That's
was in
extra
the
spicy
news
above
for
and
going
beyond.
above and beyond.
No, I really went above and beyond. It's not
And
even
I was
my
like,
another
yeah,
patient
nah.
as well. Did not attend the appointment. I've chased this patient since Tuesday. In fact, when I finally reached her, I had to tell her, see, yeah, I just did this because this is your first time. Try this again. I'm just going to put in non-attendance. Ever try this again? I don't have to be chasing you.
No.
You did not.
No.
You missed it. I left 4 voicemails. I called you the next day. No. I called you today. No. It's just finally when I said on my voicemail that if I don't get to you, I'm going to put it as a non-attendance, and this should never happen. That's when I finally got to her, and I'm like, yeah, I had to set boundaries there. Hey, no. This can't happen
Don't
again.
do that. Yeah.
No,
I mean,
I can't be chasing you around.
I'm
honestly.
always want to set boundaries in my patient because you need to do your own part and I need to do my own part. Like,
Yeah.
I'm not going to do both your part and mine, unfortunately. Yeah.
I wear my boundaries to
I'm
work.
supposed to be sleeping. I'm supposed to be
You do your
sleeping this
boundaries to
Friday.
work.
I wear my boundaries like I'm
You
wearing
wear
my
your
coat
boundaries
to
to
work
work.
because
Look at
if you don't
working.
have boundaries, they will just walk all
Yeah.
over you. Really,
Tell me something. They would use you like
like
they
a
will
rag.
use you like yeah.
But how do
like
you
the
set
odd
it
requests that come
without
to
feeling guilty?
No, I don't feel guilty because as long as I do
Why?
my job.
Eh?
Yeah, as long as I do my job, like I do my own end. Obviously that sometimes you do extra.
Yeah.
But I always make sure that they understand that this is not
Yeah.
normal.
Okay.
Because then you don't expect that from another clinician. If they don't
Yeah.
do it, that
Yeah.
becomes that they are not doing their job.
Yeah.
That's not their job. So
Yeah.
this is not this is unusual.
Okay,
Nobody
but this one
does
is
this.
like in terms of not even the patient, like your team members.
Your team.
How do
Yeah,
you
you
say
have to say
without
what
being
you done.
guilty? For example, you see back to back, and you have no time for admin. Yeah. And I'm trying that, like once I get home, everything work related shuts down. I don't want to see work. Even
Yeah.
over the weekends, I want no work. But then your admin catches up with you. You have a lot.
Yeah.
If you do that, piling up. So you're thinking, what can I say that? Please stop putting to me. And you know where I am. It's not just brief thing.
Of course, you write a whole book.
So what is it? What is it? They put too many patients on your load, or what?
I don't
On
want
your list,
to.
or?
I don't want to say without shooting myself on the legs. I'm just trying to
Yeah, I
avoid
get what you mean.
putting
But
all
I
the
think
details out
You
there.
need to
yeah.
say what you're not happy with because that's what guarantees longevity. I don't know about you people, but I'm always one of the people who believes that. For example, I have a salary job. Sometimes I do locum, and I always say, if you see me in locum, kill me. Like, give me the job. Now me, come find
for
me.
yourself. Yeah.
Do me as you wish.
Yeah.
But my salary job cannot burn me out.
Yeah.
Because
Okay.
then I would hate to wake up every morning to go there.
Yeah.
So I always set my boundary. I can't do this. For example, I was on call once and they sent me to have a medical student. I don't have a problem with that. But then I was meant to supervise them to do all those their short cases and everything. So I had to send the message that I can't do so. If people are taking it, that's fine. But I'm going to tell you that this will not work. If I'm on call, I have many things I'm doing. I don't want to add this to the list of what I'm doing. No matter how many empty slots you give me, that does not, because medical students, they need time. You can't just go. You still need to see that patient again yourself. So some people might just say, oh, let me just not say anything. But I'm like, if you want to still be the best at your job and do what you're meant to do, you have to say this is not working. It's not when something has not happened
Then that's when
that you
start
now
to
bring it
complain,
up.
and
To
then
now
Yeah.
say
you didn't
You never
you not
said
say it.
struggling.
I don't used to do that one. I'm always about nip it in the bud
Yeah.
before it gets there. Yeah, I'm happy to do the extra, but it's not the norm. So that
Yeah.
you are aware that no,
Okay.
this is not happening.
Alright.
That's for me.
Okay, so
Yeah.
that's me by week. And maybe next sometime we can talk about dealing or working with someone you're intimidated by. How do you handle that? Yeah. Yeah.
Mm.
Yeah. Yeah. Because
That's interesting.
we thank God, but we move.
Babe, do you have anything to say about working with people you're intimidated by? Well,
Maybe.
that's if you are. If you have ever been in that position.
No,
In training, especially in training, your
me, I'll
supervisor
intimidate you.
on yeah.
Me, it's me who will intimidate you. Mm-mm.
The intimidator.
Yes, because if I see the traits, I will finish it. Everybody in fact, if you've ever emailed me before since
Yeah.
I moved to UK, you will hear the news. I
Yeah.
will copy everybody. We'll finish it there.
Well, I'm one of those people that I cannot be bullied. That's one thing I know.
No, it's not bullying.
Like, first of all, I cannot be bullied and I cannot be intimidated. You know what you know. That's fine. I'm not arguing with you. If this is expertise, I leave it. Like, I'm not going to argue with you. But if you want to, if in sense of intimidation that you are intimidating me or I find you intimidating, I've not had that.
That's a way of bullying. If you are intimidating someone,
But
you
it's not
know
like
what to do.
I don't know if they
Unless
know
the person
they are
is not
being
intimidating
Yes.
you, but you feel intimidated.
feeling intimidated by your supervisor.
Are you feeling like because there are two things. It's either they've not done anything, but in your own head, you feel like
Yeah.
I'm not impressing
Yes,
this person.
yes, exactly.
Okay.
How do you work around that? What do you
Right.
do? Yes,
I see what you mean.
yes. It's not
But
like
have
they're
they
going
said
out of their
anything?
way.
Have they said
No.
anything to make you feel inadequate?
No, I just
No.
get that sense, that feeling that maybe I'm not impressing the way I should.
Impressing.
Yeah, the way I should
Right.
impress, and then because oh
Mm.
God, I really don't want to get into
I
it
think what
without.
happens in that scenario is that
Yeah.
when you and your supervisor have different personalities,
Yeah.
Mm.
Yeah.
that's when you feel like maybe am I like you sort of try to compare how you do things to how
Yes.
that person will
Person
do
do,
things,
yeah.
and then you keep asking yourself like,
Am I meeting up? Am I doing what? Yeah, because my
Because
supervisor is like
Way up there.
way up there,
But
way
that
up
should make
there.
you feel intimidated though, because at some point she was like you.
Maybe I'm using
Before
the wrong.
she
Yeah,
got
I am
there.
silly because sometimes I feel maybe I'm not maybe I'm not, performing the way she would expect me. But then we do reviews, workplace-based assessments.
Mhm.
It's not. There's no
Issue.
objective
There's no
evidence.
concern
Yeah,
or anything
but
like that.
I still feel that way. And maybe because again, it's a new place. Yeah, I started new. I'm getting used to, and I did not like the fact that they just expected that I should know.
she hits the
Mm.
ground running.
I
Mhm.
should know everything. I had to I haven't worked in this trust before. I don't know any of these things. Where I was is similar, but it's different.
Different, yeah.
You can't just expect me to know all these things. Show me, and then after you show me, yes, then you can expect me to know.
Mm.
Not just come off the bat thinking she knows what it is. No, I don't.
So definitely
Yeah,
it's coming from
but
somewhere.
It could be coming from me. Yeah, because I
mean, it's
feel-
coming from there. Like you probably
Maybe.
got off on a rough start.
Yeah.
So that already you feel like you have to justify you. I don't know, like where you are, but you don't have to though, because that puts unnecessary pressure
For
on
me, I would even
yourself.
say that
Yeah.
because throughout my training,
Yeah.
all my supervisors have been quite good. I was lucky to have
Mm.
good supervisors. My
Same.
main educational supervisor is this very soft-spoken, so our personalities are like that. Everything, like people take it like, they can, because it's okay, well, let's do it like that. Let me
Yeah.
just do it. Bang, 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 let's finish it here. When I'm writing my reflections, at that time we write those long reflections.
You still do, and I hate it.
I think when he reads my reflection, then you come here, is everything okay?
Is everything okay?
So sometimes when I'm seeing some patients or maybe are dealing with difficult situations, maybe even
Mhm.
around the workplace and all that, in my head, I start asking myself, what would this doctor do? So that's my supervisor. How would he do this? So I'm trying to just sort of breathe and try to say, let me do it the way he would do it. So like let me. So that I keep telling him that sometimes when I'm like, what would Doctor this thing do? What would this doctor? Because me, I'm not that, you know.
Right. My core training, my education supervisor was
so lovely.
Oh my God, she loved me. Well, let me not say, but like she loved reading my reflections. Well. Yeah, we got along very well. Oh my God, your reflections
into it. Wow.
So I have to be extra spicy. Yes. So but now you change. My education supervisor is not that way. I'm trying to work her out. So I need to be careful of how I put my reflection, that it doesn't rub off a certain way. Because even my clinical supervisor as well, the way I like to sign off, she was like, it doesn't look professional. She's professional. She's very old school. Like it's not so professional. So I had to change it just because of who she is. But I like to, when I put my name, I like to put a smiley face on it.
Why? Do you know what? I feel like you're trying to, I don't know, like why the smiley face? Just to show that you're happy.
Just to show you you can approach me. Don't be scared.
Approach to do that.
I like it. I like my sign off with a smiley face.
I think that's your style. Everybody has their style.
No, what I'm saying is that if I see a smiley face, I'll be like, what was in this one? That's what I'm like, what is this one doing? Put this smiley face.
You want it to be more professional?
No, not professional, but like even when people send me a message and put XX, I'm like, who is your XX? Like, why are you sending me this message?
I like it.
Where do I know you from? Where to where that you're putting hugs and hugs?
No, I don't put hugs and hugs. I italicize my name on my sign off and then put a smiley face. I liked it. I've been doing it since. But she doesn't. I mean,
it's nice.
Okay.
It's okay, but
so
I just find
change it. So I just I don't know. Maybe it's more about self-reflection and looking into myself and finding out why I feel that way around her. Yeah. I'm working on it because honestly, I've like so much so that if we're working together, I go blank. I go blank. Like, oh my God, I just go blank. And then when I leave, I'm like, you should have said this. You should have said this. Why did you say this? This is how you should have said. But you know this. Why did? But at that moment in time, around her,
you just feel that. Yeah,
I just go. It just goes. So I think
maybe you should start working on it. Maybe just take it one at a time, like one day at a time. Just say what you want to say, and again say again. Because you're going to. How long are you going to be there?
Long, no man, 6 months.
So you need to,
because I'm less than full time, so 7-point-something months. Yeah.
So you need to adjust quickly.
Yeah.
Because some of these things they're also seeing it.
Yeah.
That you're not really saying much, and you don't know what she would end up recommending.
Exactly. Like that's another fear again. What will you?
What will she try to say something, even if you sound. Nothing is stupid. Like say whatever, and it triggers a discussion, and then it triggers an open.
No, nothing is stupid. It doesn't work for me.
But you know that it's better to get over this, and because some people, they will not tell you anything. You think everything is going on okay. Then at the end, when it's getting to time of your ARC, they'll just drop a bomb in your. But then you'll be like, what? Why is this person dropping this right now? When I'm almost done, just so you know.
Exactly. So, so it's always just good to once you identify, you start working on it so that by the time you're ready for your appraisal, things like that.
You can have that conversation with her.
Yeah.
Yes.
Yeah, you can.
I would have that conversation with her, and I'll tell her that. Well,
I just feel like when it's not you,
it's not her, it's just
me.
You.
I
that
feel like
sometimes when you're around, you feel like you just go blank. Maybe that will make her also maybe relax a little bit, and maybe just have that conversation.
You know how to take feedback well. Like most of them, like if you say the way you feel, they always want to just check that. Okay, you're okay. Like I get,
I'm worried. I'm worried that
you might say I get a bit nervous around people who I feel like accomplished. Because I don't want to, act like I don't know what I'm doing. I feel like I'm letting you down.
I get
things like that. Then she'll be like, oh yeah, that you don't have to. That everything is Yeah, so that brings a level ground, and
Maybe I
it's easier
can
to
raise it up in
approach.
supervision.
Yeah.
Yeah, I get. Let me write it down. I like the way that was phrased. I get a bit nervous around people who I feel are accomplished, and then
Mm-hmm.
I lose my. See, I've lost my train of thought again. I just write that
We
down.
don't even start prefacing, like, I don't want you to feel sorry for me or anything like that. It's just that I want to get it out there so that it makes me start feeling.
Let her feel sorry for you. Let her feel
No,
like sorry.
don't feel sorry for me, because I don't want someone to come and say I have confidence or self-esteem issues. It's just that this is what I feel
You
like,
need to
but
be
I'm
careful
really
with the
working
things
hard.
you say in my
To be
my
able
niche,
to,
my mental
yeah.
health. You need to be. You need
No,
to
don't
know how
do
to
that mental
word
health
it
one.
and how to say.
Nervousness. Everyone can be nervous, and she
Everyone can
might
be nervous.
explain to you
It's not,
that
it's
the fact that you
natural.
feel she's accomplished doesn't mean everybody have their struggles,
Yeah.
So it doesn't mean that they don't have the things that they are dealing with. So
Exactly.
have that
Yeah.
conversation in a very nice, when you
Way.
guys are chill.
Yeah. You
Okay.
said, I know this is going to be somehow, but I just have to say this is
Yeah.
it. In case you've noticed that I either clam up or something, is nothing to do with you. It's just the way I feel, and hopefully I'll start to warm up and just relax with time and all that. But this is how I feel. But obviously, if you have any feedback for me,
Yeah.
please let me know.
Yeah.
Mhm. Move on from me.
Before they drop
Anyway,
something.
so moving on
That's what I'm
from
trying to avoid,
our
honestly.
yeah,
Yeah.
you'll be
Yeah.
okay, I'm sure. Let's talk about what now? Health inequalities.
Thank you for my therapy session. All right.
You're welcome very much.
Welcome.
So health inequalities among Black and ethnic minorities. See, Black Africans, not Black in general. Yeah, Black
Well,
and
it was
and
mostly
ethnic
Black, but
minorities.
it's minority BAME. Yeah.
Yes, BAME.
So if you don't know what BAME is Black. What's BAME again? Black Asian.
African.
No.
Is it Asia?
Yeah, Asia.
Did
Black
not know
Asian minority ethnic group. Yeah.
ethnic groups.
Yeah.
But now I
Black
think they're trying to
Africans.
change the BAME. See me Sualau. I thought it was Black Africans. I know it was Black Africans.
So anytime you saw BAME,
I see it, I'll be like, wait, Asia.
It's not Asia. It's Asia.
Asia. And that's okay. Maybe like the minority ethnicities. I said, how? But then, not talk about Googling it. No, seriously, every time I've said that, I'm like, where is Asia now? It's supposed to be somewhere here, but in my head is saying, are they minority ethnicities? I said, they cannot be minority ethnic group.
Why? It's Black in general, not really specifically Africa.
Yeah.
Help me. You
We need to
help
clock
me.
it for you. We
I
have
need to clock it.
Oh gosh.
Right. So among these people that's supposed to be underserved population,
Yeah.
and I think we do have it, to me and Jesse will come at it from the normal. Obviously, we're all doctors, but you know more in terms of mental health and what is you see. And I do know a bit more about me and Jesse know about more around the core medicine, really, if you put it that way. Because we worked in hospital, we worked in GP together, so we sort of know. So, floor is open. Where do we want to start from?
So we can start from how we actually came here.
Yeah.
Seeing what we see
Mhm.
on social media. I think our lovely Jess was telling us here about what she saw on Instagram about the lady who had gone to the hospital and, labor, and they actually faffed her off. Yeah. And for her to then birth the baby in the lift of the hospital. In the elevator. No, I think elevator is that stair one.
So not escalator.
Not
so
escalator,
in the
elevator,
elevator
in the
of the
elevator
hospital, like just literally leaving, and then she was,
and it happened. Then everybody had to call code. What's the code? Code 1, code 2, code 5.
222. Me over here is 222.
Everybody had to call code 1 in the hospital. And
but it's so
it could have been
strange.
avoided. Yeah. We're just looking
absolutely.
at it. It could have been avoided if they had listened to this lady. And it's not that it's a one-off thing. It's a reoccurring thing that we see on social media. And I think that's why a lot of, I don't know if we know her, on Instagram, what's her name? The midwife that advocates for Black women in UK. Marama, I can't
Mama
remember.
Dina,
Mama Dina or
yeah.
something. Yeah.
Dina,
So I
yeah.
actually really like her a lot because of what she does.
Yeah.
She advocates for Black women in UK.
And she used to work in NHS, by the way.
Yeah,
So,
I think she still
yeah.
does. She doesn't. She
I
still
think
does.
now
know
she's
if
doing
she's
private.
private.
Is it private?
I know she has her
private,
own private thing
like a
where she does
doula
like
or
private
something.
antenatal classes rather. But
Yeah.
I don't know
Yeah.
if she's still, because I know at some point they were chanting her.
Really?
I don't know, but I don't know if she's
wasn't aware
back
of
to
that.
NHS. Yeah.
Okay, yeah. So I really like what she does because I think minority ethnic group women, men inclusive, please,
Yeah.
need someone on the inside who would advocate for us.
Yeah.
Yeah,
Absolutely.
who would advocate for us? Because I remember having this conversation with another clinical supervisor who's a BAME, and he goes, have someone who will stand for you in this hospital, especially in the hospital, who will put their foot down and say, no, this is what is wrong. This is wrong. This is not how she is. If not, because of, the color of their
Of
skin,
course.
But
will be
that's not
taken for
right, because
granted.
most people will not have someone to stand for them. So we need to advocate for a system that
Yeah.
is fair.
Yeah, exactly. Equality.
Yeah, that is fair. We're not saying perfect, but it's
Yeah.
fair
Yeah,
to listen.
yeah, hopefully. But what can you do? Because when you
Yeah.
advocate, all they'll do is have meetings, strategy meeting. They have so many different names for it.
I just
and
hate
then not-
reactive actions.
There's so many different
that's the way I
names
put it.
for it.
I
and
think-
then,
Yeah.
I think it's not even about racism, or because there are people who are not racist, but there's this unconscious bias.
Yes.
that
Yeah,
is
they're
there.
just
Yes.
systemic. Yeah.
It's just there. It's not because it's just at the back of their mind that
yeah,
just because you are Black or you are Asian or you are of the minority, like you are just
yeah.
like
And it's
You're not meant
painful.
to feel what you feel, or I
what
don't
you
know.
feel, or maybe you are. I don't know whether
And
it's
it's-
like you are exaggerating
Yeah.
your symptoms,
Yeah, I
or
don't know why they feel that. And if you go down that rabbit hole, it's not just something that started now. It's something that predates. It's so way
Yeah.
back. In fact, it's so bad, especially for this one now for Black women. There was a theory then that Black women don't feel pain.
They don't
As
they
much
take
as
more
white people
pain,
do.
and that's
Yeah.
why when they're in labor, they don't really give them
anesthesia and
a
all
lot
that.
of
even still now.
Yeah.
You have
really.
to really
yes. So now they
advocate
feel like you
for pain medication.
yes,
For
pain
strong
medication.
pain medication,
I've
because
had
they have
someone say they gave her placebo.
Oh, God damn it.
Yeah.
Excuse my
So
French.
yeah.
Are you serious?
You even hear things like our skins are thicker. So
It's
for some
terrible.
reason we are not.
Terrible.
You need a higher suture when you're suturing someone, and there are a lot of things. Obviously, like even while I was in hospital,
Maybe our skin could be thicker.
no,
possible.
that's a lie. So when when I used to work in the hospital when I came to this country, I will have a couple of colleagues who are white come to me to say they can't bleed. Even some Asians, they can't bleed a Black person. They can't find the vein. And I'm always like, okay, maybe it's like really hard to
Then
find.
you go
them. And I
there,
go there and the veins are
The vein is
looking
staring
at me.
you. It's staring at you. It's staring.
God.
It's just wiggling.
It's staring at me. And I'm always like, if you can find a vein on a heavily tattooed man with heavy ink, you can find it in, because I it's difficult for me to see with that tattoo. You have to trace the vein. You can find it. Then you can find a Black person's vein that is literally in your face.
Staring at you.
You know,
Yeah.
so that
I've
was one
never
of the
had
things
that.
I noticed,
Yeah,
and I used to be
tell me
like,
about
"What
that
do
one.
you mean you can't see the vein?"
Well,
The vein
but
is
but
there.
I don't blame.
Who
Like
are you not
those who-
blaming?
No, I don't blame a lot of practitioners so much. It's because of what has happened in the. If you look at the medical books,
Yeah.
what photos of people do you see in the books? Really?
Yeah, because even
Like if you're
back
looking at
in
skin, if you're looking
Nigeria,
at skin
dermatology
condition,
was everything.
What do you
was-
see?
I didn't know how eczema presented in
In a Black
people
person.
Yeah.
until
So
like
do you blame them?
Yeah,
You can't put the full blame on. Or of course, you can't put the full blame because
and
if,
do you
for
know the-
example, they see
Yeah.
a child who has maybe eczema or has a skin lesion or something like that, they've not seen that because the books and stuff. It's all been for.
Oh,
for
please. Oh, please. Maybe it's only dermatology. Maybe only.
I'm just
dermatology.
saying. I'm just using dermatology as an
Maybe
example
only
that you can't
dermatology.
blame
Yeah.
them a lot. With
and what
these
I'm
kind
saying
of
is not
things.
even about here. Like obviously, you did dermatology in medical school.
Yeah.
I didn't know how psoriasis to, even if I see a black person with psoriasis now, I probably won't know
No, okay.
unless the fact I know is obviously will have that
Yeah.
scaly, silvery, whatever.
Yeah.
But I don't know if it will be like that.
Yeah.
You know, I've seen a black person who had lupus, and I thought she had a burn until someone told me it was lupus.
Yeah.
So there are a lot of things that I don't know on black skin because of the books we read, the books we used.
So it's played a big role in
You know,
Yeah.
it took me years
Fine.
to understand that what my sister had growing up was eczema.
Yeah.
We just felt she had very sensitive skin and used to be very black. I didn't know that was lichenification, things like that. And when they gave her steroids, she from back A, that was my father used to buy then. I didn't know that. Even when I went to medical school, I didn't know it was. I didn't even know people who suffer from eczema that are black.
Yeah,
I felt it was a white people's stuff until much later, obviously, when I started doing skincare, when I started like knowing more about skin and everything. I'm like, oh my god, oh my god, oh my god.
Yeah.
So things like that.
It's fine.
Well,
I can excuse
that away.
dermatology.
That away. Talking about the huge bias we have.
Yes, we have.
I can excuse
dermatology
because I have seen it's terrible. Okay. We've talked about physical health. Let's maybe enter mental health and the bias I have seen that really annoyed me. I was very annoyed by it. It was during my core training, and I was the adult inpatient. Okay, so we were expecting someone who was unwell, and I was waiting for admission because you have to collect them in and stuff. And I was told, oh, this person is so unwell, coming in a police vehicle. Yeah. So in my mind, I was like, okay, this must be someone that's really like very violent, really unwell.
Yeah.
Police had to step up.
Didn't use section 136 or 135. Then it has to be that serious.
And this guy comes very calm, very quiet, black man in cuffs, had two police guy walking him in to the hospital. I didn't want to jump on anything. I was like, okay, maybe he has calmed down and this is how he's presenting now. And I read the story, it wasn't really making sense. I just kept that. And then next time again, another admission. Taxi, white guy, really agitated, really almost forensic. No police vehicle, no security car.
Yeah.
Just came. Nobody was worried for their safety because but he was very frenzied, as opposed to this nice, chilled, quiet guy, black guy that came. And I was pained. I was like, okay, maybe I'm just being overly sensitive. But then you notice it in the words. He didn't need enough. He didn't even kick off enough as the other counterparts. And he's in seclusion.
Seclusion.
Yeah. And he's in seclusion. And you go, he's like, it was my tribe. And so that's another thing that really hits me. But he would speak it, but I could hear what he was saying. I didn't tell the nurses around. But then you see another person who's and they get a lot of
there's a lot more
leeway, flexibility.
The language is different.
Yes, there's more flexibility around there. Or maybe something happened. Or why don't we try rapid transfer?
Yeah.
So it doesn't take everybody's like, you see, he's so violent. And I'm looking at this like seclusion. Like, aside the pacing, like what happened?
Yeah.
Why was this flexibility not given to this man?
So because there's always that whole anticipation. Oh, I feel terrified.
Why?
So somebody has literally told somebody that instead of using the word that, oh yeah, black person, say, oh, you're a man, and because it stands also, I'm not. That's not the problem. The problem is that you are black. That's just what it is. There's nothing else.
It happens on the streets where a black, especially men, would pass maybe an elderly woman. Before they'll just grab their handbag as if
things like that. And more and more, it stops. The problem why we talk about these inequalities is that knowing the average black person, it stops them from seeking help.
Yes.
Yeah.
They don't want to be a bother. Yeah. They prefer to keep away than have their humanity.
And then they get worse. And that's the bad thing.
They become very bad.
Yeah.
when
And
things are really bad. Yes.
it's not like we're making this up, guys. Research,
No.
even records have shown
Yeah.
that
Shown it. Yeah.
colored people are more likely to be detained on that
They're all
section
colored.
I don't
than
even like that
whites.
word colored.
They're all
I
colored.
don't
I don't
like
know
that
what
word
color
colored,
means.
because
Alright,
everybody
so
has
I'm
a
skin
color.
here.
I'm trying to
No
be
one-
diplomatic. Okay,
No
fine.
one is transparent
Black
that you
skin,
can
Exactly.
see them.
dark
Everyone
skin,
has
okay,
a
dark
color.
So
skin,
dark
darker
skin people,
darker
Yeah.
darker
people
skin, yeah,
are more likely to be detained
yeah,
than their white
and
counterpart for
have
the
an
same
adverse
presentation.
outcome. Yes, for the same
For the
presentation.
same
Absolutely.
presentation.
Yeah.
And they
And
might stay
again,
on
when
longer.
you
They might
when
stay
you
longer.
complain a lot as a woman or whatever, or you raise your voice because you're not happy, you become an angry
Mad-
black woman,
Mad
right?
black woman.
Especially in healthcare, you become, oh, that she's so difficult, or that she, because of the same thing she's probably raising concern with, especially when you're
Yeah,
in labor. You ask questions like, what am I being given? What
exactly.
am I?
You're
What am I?
labeled a
And that's why I keep
difficult
saying that
person.
if you're going into labor for a woman as a black person in this country or minority,
Have
you
a
need to go with
birth
someone
partner.
who is very vocal,
Yes.
Yeah.
not someone who avoids confrontation.
Yeah.
Someone who knows how to approach and say and detect and ask questions.
Yes.
Yeah.
If you go with someone who is like, oh, let's just avoid trouble,
No.
you're going to have a very bad outcome.
Yeah, yeah. So that's why they say go with a birth partner. Tell your birth partner this is what I want to. In case during that time, I mean, pain is very bad.
Yeah.
It distorts a lot of
Yeah.
things, and I can't speak for myself.
Speak for
Stand
myself.
by it. Speak
Yes.
for me.
Yes.
Yeah,
Yeah.
this is what I need. This is what needs to be done.
Yeah.
Because
One of our friends, Tega, she is a pediatric registrar. She's a neonatology registrar. She did a work with someone on detecting jaundice in black babies.
yeah,
Apparently, it's in big 2025, it was still a problem. And she shared a personal experience of where she went to work in a hospital where she was not meant to be, was just a locum.
yeah,
And she saw a friend who she didn't even know that the wife was in the hospital giving birth. And she was like, "Oh my, I think it's just all good, to be honest." The bus she was meant to join, she missed it, so she was waiting for the next bus.
yeah.
And then she now saw this guy at the lobby. I'm like, "Oh, what are you doing here? My wife is in the she just delivered. Oh, it's 2 days now at delivery. They're planning to discharge us." She didn't work in that ward. She just went back. Let me go and say hi to your wife. And she carried the baby and she's like, "Baby is jaundiced."
Yeah.
And she was like, "Nobody has said that baby is jaundiced.
Of course.
Baby is deeply jaundiced.
Yeah.
Not just very faint sclera, deeply jaundiced."
Oh, geez.
She literally begged them that they need to take a sample now for
What
seven
did they
delivery
did they
days.
not see it?
She
This
didn't
is
work
like
in that
only
black. Remember,
person.
she was not working
black
in that
baby.
ward.
I understand. Jaundice
They
is not
took-
only skin. Can you not see it?
I said the
Everybody's
sclera
own
was
is white.
yellow.
Can you not?
So they took the blood test. It turned out that the baby had to. I think they had exchange blood transfusion. Yeah,
It
it
was
was
that
not
hard.
just
Yeah.
phototherapy. Yes. So if that baby went home, that baby would have developed kernicterus. This is a very bad situation where bile enters into the brain and damages the brain, and the baby would just not grow. You just be horrible.
Even
if
neonatal
the baby survives it.
hyperbilirubinemia, jaundice,
Yeah.
has been
Yeah.
shown to be a cause of neurodevelopmental issues later down the line.
Yeah. So if the baby manages to even survive, you will not have a normal baby. So that was a very by chance arrangement. It's just divine arrangement. So this is one of the things, and when she made that publication, I was like, this should be taken seriously. Because most people, even imagine having a health visitor who might probably pick something like pathological jaundice or whatever, and they don't know that this baby they are seeing is jaundiced.
Yes.
That's. Tell me what's your flavor. Hey. This is Loud Mamas, where the group chat comes alive.
We are 3 doctors with loud opinions, soft hearts, and way too many stories to share.
From friendships, life lessons to hot takes and a little chaos, nothing is off limits. So grab your tea, get comfy, and let's murmur loudly.
Bad. So all of these things is not just that people are just trying to say something or use race, is that they are actually issues happening
Issues.
and
Yeah.
should be
I
looked
think that
into.
we are also, the BAME, we are also to be blamed. We can't blame other
Yeah.
faction too much, because what are we also doing about?
Doing, yeah.
Because why are we not published? Why are we not doing? We have to also be proactive. We also
But
have
you
to do,
know that,
you know.
I don't know if you've known or seen people who talk about or want to
There are a lot of
advocate.
systemic resistance
There's a lot of
against
resistance.
it.
But still, it doesn't
There's a
matter.
lot of systemic
Even if there
resistance.
is,
People
we
still
still
do.
need to.
People
Yeah.
do, but there's a lot of
Yeah.
pushback. There's a lot of resistance, and the most that sometimes will be done is they will start having. Wow, I'm trying to remember one of all those lovely names that they make it. They start having it as a mandatory training.
Yeah, mandatory learning.
No,
What's it?
I'm talking about, you're talking about it from being in the West. No, I'm talking about it starting from the grassroots, from back home, from wherever
Yeah.
we come from. What are we doing?
Yeah.
People, they will not take us serious because we are not the majority in the West.
Mm.
We are the majority from where we come from. So what are we doing? We have to be proactive into putting things in place. If you don't, you have to be the one to be shouting and doing things and researching, and then also doing studies and, you know, investing in, because if you know, we are not investing in healthcare back home.
Yeah, investing in the
We are
healthcare
not
and
investing
research.
in healthcare.
Yeah.
We are always waiting for handouts from the West. And if you are waiting for handouts, they don't see
They
it
will
as a
twist your
serious thing.
story and sell it anyhow they want
So,
it. Yeah.
there's just a few of us in the West. So no matter how we push it, we can't push it so much like those who are in the ground. Like they should be pushing it and be investing. That is when the West would listen. If otherwise, we would just be screaming and shouting and doing all these things, and it's nothing would happen. Back home, it's a cup of tea. We are able to diagnose John. You can see, you can see. You don't need someone. So I think people even back home have better outcomes as Black people.
Yeah.
Yeah, for
Of
example,
course.
my friends say if you want to do a fibroid surgery, don't do it in this country. Just go to Nigeria, because
It's not only fiber, a lot of things. Fiber, keloid.
because they would possibly not get it. They won't get it right for you. So these things you're talking about they are real. Like, I think we should start trying to invest in our own health, also in our own health system, to change the narratives. Because, but I think, as much as you talk about like us, political will has a lot to do. Let's not even go there.
Yeah.
Let's not even go there, because
it reminded me of
whole
the
system.
new. I don't know if you've heard about it. That stupid policy from America. That Nigeria is a part of Rwanda, which other Kenya is pushing back about doing something with our health.
Yeah.
Have you heard about it? About doing other research in health in that place?
Yeah. I think I've heard something like that.
For the betterment of Americans.
Yeah,
It's very,
they want
very
to use the
weird.
Black to
Yes.
test Africans, to test some new
And this
medication,
is,
something like that.
this
Some
year,
new,
this like
yeah.
so. This is still ongoing.
It's still ongoing, but the most important thing is that we are identifying it and we are speaking up, and it's not right.
But the only country, the only nation that I know has spoken out is Kenya. Nigeria, I don't even want to get into the politics of Nigeria right now.
Well, since we live in the UK and we are doctors and we have seen patients, and how do you think what can we say to help these people advocate better for themselves? What do you think they should be able to say when they get to the doctors?
Well, I was coming to that, because I've realized that when I see, especially BAME people, like on a normal day, when you're taking history, you get confused. When you're asking them, how can I help today with the presentation, like asking for symptoms, then you ask for about one symptom and they will be all over the place talking about something else. So you can even lose your train of thought. You're trying to sort of, take history. You don't really know exactly what this person is presenting with. So it makes it difficult to sort of get to the bottom of what is happening. And in general practice, some practice, you have 10 minutes, you have 15 minutes. If I'm asking you, you've come with, let's say, abdominal pain, and I'm asking you to describe the character of the pain, and you say, it's doing me somehow. It's somebody is describing something as, you know what I mean. I don't know what you mean. Describe to me what you mean. You know the way it's just doing me jiggy jiggy jiggy. What is the
word?
What is it doing me somehow? If you don't explain, it will be very difficult. Well, for some of us, we might still get what you're trying to say a little bit. Sometimes I don't. Most of the time, I don't get what they mean. Like, it's doing me somehow. I don't know what you mean by it's doing me somehow. But if you are in front of someone who is not from where we are coming from, and you say it's doing me somehow, they might interpret it something differently. So they might even give you the wrong diagnosis.
Yeah.
Because what you are presenting with is different from what you are saying. Because we know we have our own slangs and the things that we use to describe things. And what I've realized is the honest truth. Our people don't know how to give history. When you are taking a history, you go around in circles before you get to the middle. The time is already, you always run late when you are taking history from I'm talking about
from your own experience.
From my own experience. That's what. So sometimes I have to keep guiding them. So I'm saying, okay, now I'm going to ask you direct questions. If I ask you, say yes or no to this. Do you have this? Do you have that? Do you have? Even at that, they still come and pop in, like they keep. You know, it makes it.
I
difficult.
feel sometimes it can happen because they've come, they've met
And
you, and they've decided, yes, they've seen you, and then, oh my God, yes, another black person. Let me just tell her everything now.
Yeah.
So that's
No, it's not really, because I've sat in. I remember when I started as a GP trainee, the first week or so, I was sitting with my different supervisors to see how they take history. And I'm sitting in, I'm not the one taking the history. And it's still, like, that was why I was like, I was confused. I was like, what is this person really presenting with? Because the same is my tongue is turning me. And you know, they give this kind of weird, we have
my demographic is Asian, and they are the same.
That's what I'm saying. That
they are the same.
BAME.
Yeah.
It's like our history, our history. It's difficult.
We don't really have good descriptors when it comes to how to describe pain.
Exactly.
Is it shooting? Is it sharp? Because these are what we learn how to use. The word used in medical school and training. And now when someone is saying something that can't describe how their pain feels, actually, like almost like when you're talking to a child, they can't really tell you if it's really sharp or if it's really dull.
Yeah. And
exactly. Yeah. So it becomes different.
So I think that is one other thing that we should maybe, I don't know how we need to educate our own people about. If you are coming to if you lose your train of thought, just write some
things down. Write things down.
I think sometimes when they come to and they see you, they feel intimidated or something, so they lose their train of thoughts and they start going around in circles. You have just a short amount of time to present your case for something to be done. But if you're going around in circles, you come several times before someone might then say, okay, now add this and that, and say, okay, maybe this is what is happening, let's do that. By that time, it might be too late. That's one part of that's one. The other thing is, of course, some things are out of your control, not because of anything, not because of a history you've given. If you are pregnant, you are pregnant. You're 36 weeks, you're 36 weeks. You are 40 weeks, you are 40. If you are in labor, you are in labor. Head in perineum, head is in perineum. What if labor is delayed, like delayed progress of labor, for example? Why are you delaying a BAME from having a cesarean section when if it was someone else, you want to do an emergency cesarean section?
Okay, I have an answer for that one. Sometimes I don't really blame for that particular CS one because, again, we know where we're coming from. CS is considered abnormal for some culture. That
they haven't said they don't want to have
they haven't said they I'm talking about a case where you have two let's say you have two women of different demographics.
Okay, I think I get where
when they come
now.
In,
yes,
they are both.
You offer this one.
You offer because let's say delayed progress, or maybe
I get it now.
And that. Because you are BAME,
yes, okay.
A decision to be made for things to move quickly for you to have a cesarean section.
Okay, yes,
delayed.
Okay, yes, I get what you mean.
If it was the other way, they might get things done quickly, and then the outcomes would be better.
Yeah, okay, I get what you mean now.
If you are BAME, so that's when you would have to be able to advocate for yourself and know what you want and ask for things. And people need to, and we also have to. We don't like to read. That's one thing. We don't read. We don't like to read. I have to be very honest. We don't like to read. Things have been put in book. They've given it to people to go. They come back. They've not even opened the book. They don't read. They don't read to ask questions.
I think that's like universal.
It's not universal.
It's universal. I will tell you.
I haven't. It's not.
At least because I know I've met the other everybody. Most people don't like to read about anything. They just tell me what you want to tell me. I
No,
don't
but
have time to
see,
read
no,
this leaflet.
people, no. What I did obstetrics and gynae as part of my rotation, and I've come across the two,
Diverse groups, yeah.
and I'm telling you that BAME people will not, even when they've come in. Of course, the other group, there are people too who don't read, but a lot of people come and they have questions that they have for you. You know, they have questions that sometimes.
But you know, it has something to do with a cultural thing where the way we were raised. I don't know, back in Nigeria, you don't question doctors. You just do what the doctor told you to do.
Patriarchal thing.
Yeah. So most of the times, you just say, when you ask, like, for example, when I meet my older patients, I'm like, what do you think? These are the options. Which one would you prefer? If you do this is the, just tell me, anyone tell me, doctor, I'll do. When I'm speaking to the more elite, probably people that have now, you know, try to better themselves or that have a bit of knowledge, they're always like, okay, maybe we should do this. So it's a bit more, you know, there's a decision and there's a that's discussion there, compared to when you meet people who have come from a certain demographic where it's always a doctor said this. They don't even tell you medications you're taking. They just written and they give you. You don't know what the name is. That's what happens most
There
times.
is that part, but for me, from what I have experienced, they come in and maybe they've even been given maybe leaflets to go home with, and they come back and we don't read. We don't read, like it just like you said. I know you said when the people come in, they feel like the doctor has all the answers and all that, so the doctor would. But you are going into labor, for example. You've not read anything about that. You think you just go and you lie down and then the baby push. Like some people don't even know the stages of labor. I'm not saying that just for BAME, but a lot of people don't even know like what happens in what is first stage, or they have made things very simple for you to understand. Like when you go in, this is what will happen. This is what you have to ask questions so that you know what to expect. But if you don't ask questions, the person can give you the barest minimum information. So if your birthing partner, it's not everybody too who has birthing partner, and don't forget that for BAMEs here as well, some people might come into labor without anybody. They don't have anyone. Either they are because they are living in this country alone, or maybe their partner has gone somewhere and is working, and you know, so they might be alone at that time. They don't have anyone. So that's why you need to read. You need to learn. You need to read about it, because you are alone. Anything can happen. Who is advocating for you? If you don't have anyone there at that time who would advocate for you, then your life is at risk.
Ladies,
so we need to educate our people about reading about their own health. Why you don't know medication that you are taking? You've been on Ramipropofol.
But it's not just. I see a lot of white people as well.
I know it's not just BAMEs, but when it comes to, you know what is happening. It's all over. Or it's all over on social media. You see the outcomes. You see. So this is when we have to sit up and read and know what is going to happen to our body. That you just come to the hospital and we are not talking. And then we have the other extremes where they come with their guns blazing.
Wait, before we get to that other extreme, let me just use this platform. Please don't be afraid to advocate for cesarean section. Cesarean section is not abnormal labor. Please, ladies.
Delivery.
It is not abnormal delivery. It is not a curse. It is not, I'm not as strong as a Hebrew woman. If your labor is not progressing like it should, advocate for cesarean section. I'm trying to stamp out the use of, how did you give birth? Normal vaginal delivery, as opposed to abnormal cesarean section.
I had a baby.
Please.
That's all. You had a baby.
But history-wise, you have to ask that how was a baby born? But you have to ask.
No, I mean, if you're talking to your doctor, you don't. Nobody needs to know that information. Not outside.
Yeah, you had a baby. You had a baby. How the baby came? It's not.
Yeah, that's for outsider. But I'm just saying, please, BAME, advocate. If things are going wrong, ask. When do you think cesarean section will be appropriate for me? Do not say no. I don't want, in your mind, I don't want cesarean section. I'm a Hebrew woman.
And sometimes the pastor has told them that they have to.
I think another thing that happens is that most of us are afraid, and I get in a place where you don't feel like you belong. You don't want to act like you're being an inconvenience. So you shouldn't feel like we are being or feel like you don't need the best. If you're not happy with the information you're getting, you are entitled to a second opinion.
Yes, please.
You're entitled to a third opinion. You're allowed to think about what it is they've told you, and you're happy. People are supposed to explain what they are doing, tell you the disadvantage. Not just a small procedure. What procedure? What risk does it carry? Does this fit into my medical history? Is there something else that can be done? Because sometimes we get into the habit of, as medical professionals, especially when it has to do with surgeons, to quickly do something and just go, or do something that does not lead to a poor outcome in terms of maybe morbidity or mortality, but it's not the best thing for that person.
The easiest.
Yeah. So that should be discussed with you fully. You should have your question. You could ask, can I read and come back and tell you my question? And I have questions. You should be able to have that. And if your midwife is being pushy, or you feel like people are not listening to you, you can always ask for a change. No matter what people think about you, that's their business. Because I have seen worse people that they don't play with them, you know. So you need to be able to say, I'm not happy with this. You should be able to write that complaint if you're not happy, and get what you need. Because now who survive? They talk.
Yeah.
If you don't survive, oh, forget it. You know, you're gone. You understand? So you need to be able to be brave, be confident, to use your voice to say, I'm not happy about this, or I'm happy with this, or can I know more about this, or what? You know. Yeah.
And I think that as health professionals, or as doctors who are in these sort of positions as well, it's not like you are favoring one what do you call it race than the other, but we should be able to as well, because speak to these people, let them know what, like, you know, because when they come to some people are scared. First of all, it's a new environment. They don't know anything. They don't know how the system works. They don't know anything. And they come in sometimes either alone or with someone who also doesn't know. It's as clueless as they are. So it's like the blind leading the blind.
3 blind mice.
You know, because I remember when I was in obs and gynae, there was a time when I saw a patient who was a Black lady who had come in with, you know, heavy periods, feeling dizzy, blah, blah, blah. GP had seen, referred to gynae because patient was there. When immediately I saw the patient, I was supposed to collect the patient. I saw the patient. I was like, this one looks great. She looks great. This patient looks like great. I just gave her a bed. Immediately, I didn't even start the clocking. I just said, let me take samples. Because this patient looks like
proper pill.
This is not pill, it's gray. Like she would just pass out.
Yeah.
And the blood that I took, it looks like squash. It's like you just took water, just put a drop of
red.
I ran to the lab with that sample, because I can't wait for, if I say I'm waiting for it to be collected, because when I got to the lab, I knocked on their door. They came and and we said, this is this. I said, it's not serum, it is sample. It is the blood. So if you don't really know,
you probably just leave her waiting to be cleared,
and maybe sample will be taken. What if tomorrow is when the blood result comes, or somebody will now
just
take the sample and check?
she'll
just pass out. I don't want to say what the result of the blood test came. I wouldn't say it but it was
very low. Yeah,
more than very low. Do you have something below low? That is what it is. I was even amazed that this person managed to walk and came in. You know, so if I'm not BAME and I don't know what severe anemia is, you won't be able to tell that this person is like a walking, you know.
That even brings me to this: people who have sickle cell anemia, right? Most people in this country don't know how to manage sickle cell crisis. It was our bread and butter because that is where we grew up. That is one of the things you know when to identify a sequestration crisis. You know all of those things were just normal things.
Yeah. And
obviously when I've come here the first few months, and I saw my colleague panicking because the patient he picked was a sickle cell patient. I was like, what do I do? What do I do? What do I do? He was really like, it's like, just make sure you check,
and
ask them what a steady state hemoglobin is, and check that the hemoglobin is fine, palpate their tummy, make sure they're not in pain, make sure that they are well optimized. And most of
well
my
hydrated.
people,
And
because I have an SC, a
psychoeducation.
sickle cell group that I'm part of, from Nigeria. I used to be one of their advocates. And one of the complaints they have in this country is that they make them feel like they are drug seekers. They are seeking
Exactly,
pain
when
relief.
they come with their pain crisis, with bone
because
crisis.
their pain is bad. They have a care plan. Most of them that are under hematology care, they have a care plan. Please follow their care plan, medical
The
professionals.
thing is, they don't understand a vaso-occlusive crisis. They
No,
don't.
they don't.
Please
do
follow
not-
their. If you don't understand anything and the patient is telling you, I don't have paracetamol for my pain, don't
And that
think
is the
it's just a
same
normal
thing
pain.
that we are talking about.
Don't
Color,
give
they
them
feel-
paracetamol, please. Don't. That's not that. If they have a care plan, they tell you exactly what takes them out of their pain. Please just give it to them. They are
Even
not drug
if you
seeking.
know, sometimes that patient might not even have a care plan. That might be the first time they come.
Yes,
to
some
the
of them don't.
UK. They've just been unwell and they've come to A&E.
Yeah.
And immediately they see sickle cell. It's like, oh, you've dropped everybody just goes
bomb.
cold. Like that,
Yeah.
and then everybody, like, I'm like, it feels just like that. So they've not really you see.
They've
So
not.
this is something that
yeah.
we BAMEs, we suffer it.
because it's a minority
Exactly. So
problem.
so you see, they
Problem.
barely touch on it in medical. They barely
Yeah.
touch on it. It's only unless the person has done hematology or it's a hematologist or so. Those are the only people who know a lot about it. Like I remember, I've
No,
seen
you
a
can't really
patient.
blame them. It's the same way we learn tropical medicine because we're in the tropics. The same way most of them cannot even manage malaria.
Oh, but
Yeah,
you get
well, no,
malaria,
that
you get
even
an
good. If you have
infection.
malaria, you have
Don't go
leprosy
there.
in
You
this
have an infection
You
that
have
they have to call.
Ebola. That's
They have
what
to call
equivalent of it.
infectious disease department. A report. They have to
Infection,
report.
they will
You'll
isolate
be
you.
isolated. You'll be in fact.
Don't even
you
go
don't
there.
even go there.
When it
The
comes to
mosquito,
tropical,
the anomalous
Yeah,
mosquito
don't
followed
even
you.
go there.
when it comes to tropical illness, I give them
See,
No.
can't really blame them.
no.
Do you know why I'm saying this? Because even Asians have sickle cell.
They still also
and they've
have.
lived in this
Yeah.
country long enough for you to actually incorporate sickle cell in a medical curriculum that anybody, even an F1, should be able to
Able
manage,
to
a
manage
sickle
or
cell crisis.
identify
And
as well.
identify a sickle cell
First
crisis
of all,
and
the
know exactly
identification.
what to do.
Exactly.
The one thing I learned in medical school is always ask them, what is your steady state hemoglobin?
Yeah.
Most sickle cell
patient
anemia
Yeah.
patients, they know what their steady state hemoglobin is.
So,
Because you cannot see 80 and that's a steady state, you can't transfuse them.
so the thing is that
So
first of all, the
that's-
identification is the problem.
Yeah.
If you identify something, that's when you can even think about how am I going to treat it.
Yeah.
Manage
But if
it,
the person comes in and they are in a lot of pain and you think the person is just being over, like, and
But
they
you
are-
ask them, they tell you, I'm a
exactly
sickle cell patient and I am in a crisis. You should know how to
how to
manage
manage
that.
that.
It should not be something that you be saying, oh, we just gave you paracetamol now. We just gave you
Coding.
morphine. No,
It doesn't touch it. It
that
doesn't
does
touch
not
it.
cut it. So these people should know, like these are the things I've seen that most of
Yeah.
them have, complained about. And at the end of the day, thankfully, some centers have like hematology direct access to
Access.
them.
Yeah, I think
But
it's
some
only
centers
one
don't.
anyway. Great Osmonton in
No,
London,
in
and now they are
Nottingham, they
closing
have a
it very
direct
soon.
ward where
Oh,
they just
really? In
go
Nottingham?
straight.
Okay,
Yeah, they just
okay.
triage them straight and they go there. But
Okay.
before they even get there, some people already like start complaining the way they leave them in the A&E.
Yeah.
Those people can go from 0 to 100.
So that's the
In
so
its-
that so
in-
I think
in twinkle of an eye.
I remember
Yeah.
I remember seeing
Yeah.
a patient maybe a couple of months ago who looks like has gone in twice or something with in a lot of pain, and this patient is a black patient. So
Yeah.
and she's coming, she was in a lot of she was shaking, everywhere, cannot stand,
Yeah.
cannot do anything. So first of all, immediately I saw her, the first thing that clicked in my mind was, is this patient a sickle cell
You know, we
patient?
can't
Because
tell.
You see,
you know,
it's a she.
you know,
Yeah.
we know.
Yeah.
I'm like, is this
Yeah.
patient so immediately it was one of my colleagues who was going to see and said that this. I'm like, I think you should find out from them whether they are sickle cell. First of all, it wasn't
Yeah.
my patient, but with the way I was on the corridor walking when they were coming in and they were shaking and they were, the way they were like they were somebody who is
Yeah.
in pain.
Mm.
So then they came to ask, and this is someone who wants to say that, oh, is he sickle? What? I said, so he asked them all these questions and all the family history, any siblings, or if they, because in this particular case, no family history of sickle cell or anything,
yeah.
never been diagnosed, was born here. So never been diagnosed
Checked.
or anything.
Yeah.
Exactly. But
I know we
but
don't
the
do
pe-
genotype here.
Exactly.
routinely.
Yeah.
So, but that was what came to. That was the first thing that came
As you
like
saw
that.
her. Yeah. Yeah.
As I saw, that was the first thing I said.
Once you see
well, I
them,
think
you just know and you just keep
Yeah,
quiet.
even if they are on the bigger side, even if they have flesh,
Whatever.
that they are not slim or anything,
slim with
you
all
will
their
see that
bossing,
frontal
with their
bossing.
bossing,
You see
whatever.
that you can pick it. So that's the thing, because
I'm
you are
like,
used to it.
this
Yeah.
patient would need to go to the hospital after you. I think that because they need to go and be investigated. Because even if she doesn't know, what if this is their first presentation?
Yeah.
You don't know. But that's the thing. Because if I wasn't there, I don't know. Maybe they'll still
And
manage
some people
to treat you.
are what is it SC, but they don't
SC,
know.
but they
unless
don't
they
know.
live in
Exactly.
adulthood, because they don't have as much crisis as the
exactly.
AS. Yeah.
So that was what. So I said,
and if they have, it's really horrible.
exactly.
So, yeah.
That's just the huge. If you've not experienced something, that's what I'm saying. I don't blame them too much because they hardly see, something that you don't see content, because practice makes you perfect. It's not something they'll see maybe once in their career.
I'm saying when it comes to
Also-
tropical or all those things, I give them a little bit of flexibility. I'm more
I
flexible
know,
with them.
because you are able to diagnose chinkingwanya. Things that all those glycogen storage diseases that their name is long and joined together, you can diagnose it. You should be able to also know the common conditions you will have.
But that's it.
I know, like,
Common things or
But it's not common. It's not
yeah,
common
no, because what I'm
presentation.
saying is that Asians have sickle cell.
But they have thalassemia. They have
Thalassemia, it's
thalassemia.
not
they have
thalassemia,
sickle
they
cell
have
as
sickle
well.
cell. I know they have
They
sickle cell,
have
but
sickle cell.
thalassemia is
If you
more
draw them up,
prominent.
they
Yeah,
do
it's more
have as
prominent.
much burden that we have as well.
Yeah.
So it's not something that should be rocket science. It should be taught,
But they are
because
still
you're having
Asians
more
are
and
still
more.
BAME.
Yeah.
You're still talking
No,
about
what
the
I'm
same
saying
thing.
is that you're having more and more of that presentation.
Okay.
So it
Yeah.
should be incorporated in your curriculum and in your training to be able to say this is because these are the things that are very hard.
But now,
to
maybe
miss.
now
But
it's becoming common. So common things occur commonly. So maybe
I pray and
now
hope so.
in their curriculum they'll be starting.
But that's what you think. That's what you think. But it doesn't work.
And
like
again, the people who, I think that there's also a thing where, obviously, I don't know whether anyone in power will listen to our podcast. Hopefully they will, giving them or putting them in the category of the people who should get medical exemption.
Yeah.
That should also, they are not
Yeah.
at the moment, but other conditions like hypothyroidism and the other ones are there. But sickle cell is not. So they do need to be under medical exemption as well, so that they can get their free prescriptions. And if they need to.
Well, I think that's for
it,
England. Only England
Because-
doesn't do free prescription.
Yeah, in England.
So
because some of them also,
Scotland
struggle with
and
low finances
Ireland.
because they're not able to work during their crisis and not even keeping jobs like that because of the many times they have to be off work because they are unwell and adjustments at work and all that. So obviously, it's a whole thing. It's a whole topic, as we know.
I think
So
we can't finish that topic today. If we want
I
to-
think
No, we
most
can't.
of this also needs to come to us health practitioners. We need to be more empathetic.
to everyone in general.
To
because
everyone. No one doesn't have to. Even the people find it difficult to articulate their words, you have to be patient. You have to be. You're in a position of authority already. The dynamic is not the same. Someone is confused. Someone does not know where to start from. Sometimes they are upset and frustrated, and it's not always towards you. I've had patients that have lashed out at me, and if they were best friends, because they're like, I feel really frustrated. I have distrust over medical professional because this has happened to me or the other way. And I'm like, yeah, please just, calm down. I'm just here to help and all. But we should also try to be, reasonable, try to be empathetic with our patient.
Yeah.
I've had a bad experience today at work where I've sent a patient into the hospital. Our A&E currently, they're not taking patients. And the patient got there with a note and nobody would look at the note I sent her with. Nobody will look at it. At least look at it to redirect her to the right place to get help. And she's BAME as well. And she's crying. They don't even care that you're crying. And people are saying it because they've not been on the receiving side of healthcare. I have been. And I know how, sorry to say, mean some health professionals can be.
Yeah.
Like, as if once they write you off, they don't care about you. They treat you like a pest. I had to beg someone to speak to me, and I spoke. The person was just shouting about that. I said, relax. Say, oh, because I didn't call. I said, I have called your department several times. Said I didn't call. The patient said, I was there with the doctor ringing for over 20 minutes. Nobody picked up. So am I lying then? I said, what the least you could do was take the paper a doctor gave a patient for crying out loud and read through it and say, okay, fine, we are not taking patients now. Go to so and so, please. I mean, you don't even want to take it.
It's a discussion for another day. At what point do we lose our empathy?
I don't know. It's just, if you don't want to be there, just get out. Sorry to say, you just leave. You don't have to do a job you don't like. When you're going there to be mean to someone, you don't care whether they are people that are people's family or friends or whatever. You're just being mean because, we need to stop people from misusing the system. Okay, are they the ones misusing the system? They are there already. You know, things like that. So, and then if you see the frequent attendance, you frequent flyer, you not give them tea. You give them bread, you make them comfortable. But the ones that come once in a while, you want to treat them like as if they're the ones misusing the system. That's unfair. Please. Because that can make you miss, important things. That's just not nice. Anyway. That
I think maybe we might have to do part 1 and part 2. Because you still have the other part of it, like Jessie brought out the guns blazing, which again, like I said, I don't really blame them because a lot of us have heard
you've been through it in this country.
So you have to,
but it's not nice to be on the receiving end when it's
definitely not.
It's not.
I have been at the receiving end of that a couple of times, and I'm like,
all of us have been. I've been as well. Yeah,
it's easier to navigate it if you come from a place of understanding. Yes. So
yeah. But yeah, it's been a good chat. So you guys to weigh in your experience.
Yes,
you've had as a black African, black Asian minority ethnic. Your experience and how you arm yourself before going to the doctors.
What kind of guns do you take?
What do you go with? Do you go with all your information,
or machete,
everything like in your hand, your folders,
a pistol?
You will all your folders. So I say when the doctor say don't have, say no, I have it. It's on day 20 something. I came here and they told me this. You put it down. I have patients that when I call them, they say, "What's your name?" I say, "Spell it." I'll spell it. They write it down because I'm like, it's fine. In fact, I don't have a problem these days because I'm like, I know what people are going through. So yeah. So love to hear your experience. Want us to talk about your experience? That would be also you can share and DM. Okay.
So it's been a good one.
It has been a good one.
So we'll call it a day and we'll catch you on another episode.
Yeah.
Bye, guys.
All right. Ta-da!
If you're loving this podcast, be sure to click follow on your favorite listening platform. While you're there, give us a review and a 5-star rating and share an episode you loved with a friend. Loud Mamas is presented by your hosts, Doctors Imelda, Jessie, and Dimogo. Our producer is Chidera of CBO Creative Planet. If you have any questions, please send us a DM on Instagram at loudmamaspod or send an email to loudmamaspod@gmail.com. Loud Mamas.